so I thought I would weigh in somewhat quickly on these world events that are occurring right now with this COVID-19 thing. I get this question a lot lately, and I want to come at this from more of a social perspective, not so much from a medical perspective, though I will give you a little bit of that information. This is not meant to be treatment, as always, nor is this meant to constitute a doctor-patient relationship. Thanks for tuning in. So, it is my observation out there in the world right now, there is one class or extreme. I will call them both coping mechanisms because I suspect that that's what they are, responses to what's happening. On the one hand, you have the panic, hysteria, massive purchasing of toilet paper and everything off the shelves in my grocery store. That is on the one hand. And then on the other end of the spectrum, you have what I would describe as the head in the sand kind of coping response, which is, I hear nothing, I see nothing, right? I go out to the store on the sale on Saturday where there's 50% off, and there are massive numbers of elderly people compressed into a small space in this store because it's so crowded, with no regard for what's happening, right? That's the other end of the spectrum that I have observed. How then shall we proceed? I would advocate for a middle of the road. I'm going to cut to the chase right there. That's all you wanted was, then exit right now from this awesome video. So on the one hand, let me give you the positions, really, or the arguments as to why people are leaning in one direction or the other, assuming there's some kind of actual substance beneath said positions. But like I said, both ends are kind of an extremist coping mechanism in very different ways. So, panic, on the panic side, well, from a medical perspective, we do have a novel, meaning new, virus that has jumped species. It's likely that COVID-19 came from bats. Probably they're thinking there was an intermediate species and then jumped to humans. Anytime you have a major shift like that, the new species, humans in this case, have no what's called specific immunity to this new thing. A specific immune response can take anywhere from 7 to 10 to 12 days to mount in a healthy human being. We have non-specific immune defenses, but those are very generalized. And if you want to deal with something like a virus, you have to mount a specific response eventually. So that is on the one hand, one piece that's concerning, right? That we have no specific immunity in pretty much the entire population. That is why this thing has become a pandemic, partly why, I should say. Because nobody's system has ever seen this before. So that's the one argument. In the cases where that is more severe, so you have 20% of the cases that get COVID-19 that are more severe or life-threatening even. Less than 20%. That's a ballpark number. The other 80% have very mild cases, mild symptoms, some of them to the point of there being no symptoms at all. They are asymptomatic. So that's 80%. So just looking at chances, you got a good chance you're going to be in the 80% group. Of the 20% that have a difficult time, a more severe experience with the virus, those are largely two classes of people. I'm going to say three classes of people, sorry. Largely, number one, older people. So the older you are, the greater the risk this thing has. for you. Number two, anybody who is compromised already by some other chronic health condition. I'm not going to even say condition because smoking is a risk factor. If you're a smoker, this thing affects the lungs. Smoking affects your lungs, compromises your lungs, so therefore you may have a more difficult time dealing with this because you've got exacerbating factors like smoking. So those two classes, and then the third class I would say that gets added to that would be healthcare providers are at greater risk, probably likely due to exposure to higher viral loads in general, and continual exposure to the virus. If you're working in a healthcare setting, even in wearing personal protective equipment, there have been cases where physicians have contracted the virus. They're not really sure how, and so those three classes of people are at greater risk of being in the 20%. When it comes down to it, we don't know, right, where you fall. You may be an elderly person who has a more mild case, and so it's kind of a guessing game for all of it. So 80 to 20. That is the reason there is substantially more panic with this, panic in quotes, because of those variables. But on the other hand, the head in the sand side of things, well, 80% of patients, it's very mild. Why are we worried about this thing at all? Well, that therein is a little bit of the catch-22, because you have a lot of information gaps that we still don't know because this is new. So, number one, we don't know. We know a little bit about how this thing is transmitted. It can be transmitted, we think, the respiratory droplets that are coughed up from the lungs that land on surfaces, and then someone touches said surface with their hand and then touches their mouth or their eyes or their nose, and that's how they get the virus. That is what we think are a large number of the cases in terms of how it's transmitted. And we think if you're in close range with somebody within 6 feet of them, that you're more likely to get the virus that way. But we don't, some of these things again are unknown or known to some extent, but not fully. The other thing we don't know is how long someone can transmit the virus. So there's always kind of with anything a sort of a prodromal phase, a phase where you are pre-symptomatic. The question remains, are you able to transmit the virus at that point? They think it's tied to you having symptoms, but there have been cases where people are transmitting it and they appear to be asymptomatic. So those could be outliers, meaning less frequent, but we're not sure. So we don't know the period. We also don't know how, after someone clears the virus and gets better, how long they continue to transmit the virus post symptoms. And again, there's also question as to, based on age, are there different manifestations of the virus? This has come up recently. I was reading on Medscape that, it looks like in children, they're wondering why children don't seem to be affected by the virus. Well, it might be the manifestation in children is different. Most of us were taught in medical school, like, if you have something with a child, it starts with vomiting. It starts with a GI thing. It turns into pneumonia or turns into whatever. It starts with a vomit. And it could be that kids are expressing different manifestations of the virus and are actually have the virus. Because they looked at some cases in China. First of all, a huge percentage of the kids that they did test didn't have the virus. But then you had a smaller percentage of children that were tested because they had a family member with the virus, and they were in close proximity to these family members, and lo and behold, some of them actually had the virus, but the only way they found this virus was in fecal samples. It was in their stool. But they didn't have even respiratory droplets. That wasn't what was showing. So it could be that we've got a lot different pictures happening worldwide with children versus adults, right? We look for respiratory symptoms. If we're looking for respiratory symptoms and we have them, we're not likely to test the children to find out if they actually have the virus, and some of them may. We also think they're probably like little human incubators, passing this to their grandparents. So the arguments against the having our heads in the sand bit would be the fact that we have our elderly people and our immune compromised or chronically ill patients in our communities that are most at risk. What's happened in Italy that we don't want to reproduce in other countries is that the curve and the explosion of the virus in those places has gone up very steeply, to such extent that they've gone beyond the threshold of what the system can handle. So you have a given number of beds, hospital beds. Sure, you can try to set up tents and have triage units. Sure, you can try to have, acquire more ventilators and more personal protective equipment for caregivers. But the problem is you do have a limit to the number of trained people in a given community that can handle this thing. And so what happens is in Italy, they went beyond that limit very quickly into this zone where they're not able to handle the number of beds that they need or the number of ventilators that they need. And so that's where you have unnecessary and useless deaths in a community. Because you either can't treat those people or are treating them poorly because you can't give them what they need in order to try to survive this window of time where they're going to be have acute respiratory distress. And so that's the issue, and that's the argument why we can't have our heads in the sand, why we all have to do our part and take responsibility in terms of stopping the spread of this virus. And the way we stop the spread of this virus is we socially, I would say more physically, we disengage from one another. We separate a bit. We don't have large public gatherings. We limit ourselves in terms of how much we are out and about in our massively moving society. And in so doing, we hope to flatten the curve so that, yes, one, you're going to extend the amount of time that this thing happens, but hopefully your system, your health system, is able to manage and handle the cases that are coming in because you're slowing down this curve. You're trying to flatten the curve is how they describe it, flattening the curve, because you're spreading it out over a longer period of time, where then your system can handle people, especially as people get better. You have more beds free. So again, to rehash the basics, we don't need to panic. We don't need to feed the mass hysteria. But what we do need to take this seriously, and we need to realize that it is our collective responsibility as societies, as communities, to take care of our neighbor, to care for our elderly neighbor who is at greater risk. And that is the argument why we need to be okay with having our lives infringed upon, so that, I can't go to the movies down the street. I can't go to see a show at Red Rocks, and that's okay, because I'm hopefully leaning into this from a space of compassion and kindness towards my fellow human beings that potentially could be harmed greatly by this, could lose their lives to this. So that is the argument for why we need to land in the middle. Both take it seriously, don't blow it off, but at the same time, we don't need to be in a space of full-on panic. We need to be logical in what we do to try to perhaps increase the number of beds we have, perhaps make sure we have tests so that we can assess where this is in the community and try to do our best to handle it. Thank you for tuning in. I hope that was helpful. Adios.